The blighted ovum, also called an anembryonic pregnancy, occurs when an early embryo never develops or stops developing, and it is resorbed and leaves an empty gestational sac. The reason this occurs is often unknown, but it may be due to chromosomal abnormalities in the fertilized egg. Blighted ovum usually occurs early in pregnancy, sometimes before you even know you're pregnant. However, you may be aware of your early pregnancy because of a positive pregnancy test or missed menstrual period. A pregnancy test may be positive because the early embryo secretes a pregnancy hormone human chorionic gonadotropin, HCG, until the embryo stops developing and fails to implant. You may have symptoms of early pregnancy, such as breast tenderness, nausea and vomiting. But when the embryo stops growing and hormone levels decrease, pregnancy symptoms subside. At this point, minor abdominal cramping and light spotting or bleeding are possible. An ultrasound will show an empty gestational sac. A blighted ovum eventually results in miscarriage. Some women choose to wait for the miscarriage to happen naturally, while others take medication to trigger the miscarriage. In some cases, a procedure called dilation and curettage (D&C) is used to remove the placental tissues. Most women who have had a blighted ovum go on to have successful pregnancies. If you experience multiple consecutive miscarriages, talk with your doctor or other care provider to identify any underlying causes. A blighted ovum will eventually cause a miscarriage, usually at 7 to 12 weeks of pregnancy. Your body realizes that the pregnancy is not developing properly and starts to shed blood and tissue from the uterus. What is the main cause of blighted ovum? A blighted ovum is usually caused by chromosomal or genetic problems during cell division. During conception, the egg will begin to divide shortly after being fertilized by sperm. Around 10 days later, the cells have formed an embryo. With a blighted ovum, the embryo never forms or stops growing after it's formed. How common is a blighted ovum? Blighted ovum is the most common cause of miscarriage. Experts estimate that blighted ovum accounts for about 50% of all miscarriages in the first trimester. About 15% of all pregnancies end in miscarriage before 13 weeks of pregnancy. Statistics show you will likely have a normal and healthy pregnancy in the future, even immediately after a blighted ovum. In a study involving women with early miscarriages, around 80% were able to have a successful pregnancy within the next 5 years. Treatment for blighted ovum. After a pregnancy loss, the placenta and sac need to leave the body. The process can cause pain and bleeding. This can happen on its own, or your body may need help. When a fertilized egg doesn't become an embryo, this type of miscarriage occurs. While your HCG levels may have triggered a positive pregnancy test, they're not likely to rise any further and will instead stay low. There are also a number of reasons why a blighted ovum can be misdiagnosed. During an early pregnancy visit, your doctor will typically use an ultrasound to look for signs of a viable pregnancy. If the doctor sees what they believe is an empty embryonic sac, they may tell you that you have a blighted ovum. That was quite easy. Ultrasound made easy. Learning is fun. Press subscribe button.